Nowadays, it is very common to have problems of upper respiratory tract infections in the people. If I say upper respiratory tract, many people may not be knowing it. Very commonly, when people get the cough or mainly the sneezing, the running nose, lot of irritations in the nose, backside of the nose or the throat. Very oftenly people have really difficulty in the breathing and they feel very uncomfortable by a large associated with little bit secretions in the nose and they may feel very uncomfortable. So these are the very common symptoms in upper respiratory tract infections, and these infections are mostly due to the changes in the suspendable particles in the air, especially when we have the winter seasons. Now we have November, December, January like seasons. Very commonly in the cities also, or even in the rural areas also, a lot of suspendable particles will be there in the air. That will create a sort of irritations in the nose, and starting with an itching in the nose, followed by a running nose, there is a watery secretions comes. Then later it affects the throat infections and so on. These are very common symptoms. People will complaints in the clinical practice, and they commonly take some medicines to stop the secretions like histamine, antihistaminic drug like chlorpheniramine and maleate, or this type of very antihistaminic drugs or avil like products are often used by the practitioners, but this will keep a sort of drowsiness as such, cetirizine like drugs. So better try to understand how this happens. Nowadays with the mask, a large number of upper respiratory tract infections are drastically reduced, but still there are a lot of possibilities that these upper respiratory issues are manifest. Very common thing, what first thing we have to think is that whether is our nasal tract is correct or not. There are two reasons will commonly disturb the nose. One is the septal deviation, which is called the deviated nasal septum. We have a septum, a central bridge in the nose that will divide the two nostrils in the proper way. So whenever there is a change in the concentration of the particles, suspendable particles in the air, that when we inhale that things into the nose, there will be a response to that. So if there is a narrowing of the nasal area, just like in a one-way traffic, whereas a truck is kept in that one-way traffic, then obviously there will be a block. Similar way, the pollen things or the particles will inhale and there will be a response to that. So there will be slight swelling happens. Parallelly, there will be a collection of these particles by the cilia or the hairy root in the thing, and body will try to push it out by a sneezing. So we will start getting a feeling of scrubbing or rubbing on the nose and we will sneeze. But along with that, there will be a sensitivity of that area. The simplest thing, most common thing what we should do is that we have to check whether our nasal tract is clear or not. If there is some blockage is there, the simplest thing what we can do is that kindly we have to make that area tract clear. The easiest thing we can do is to use a simple salt water. Take a 10 ml of water, or even you can take a 20 ml of water, put a little pinch of salt, sea salt, mix it with that and put a few drops of that salt water into nose. Immediately that nasal area will be opened. But you may feel a slight irritation. Whatever we put it in the nose, we may have irritation, but when there is a salt is there, there is also irritation is there. So that will open up the tract. Then try to see why this is happening. This is because of the immune response. The easiest thing in Ayurveda what we do is that two drugs we can use very easily that responds to the upper respiratory tract. One is amalaki, that is the nellika, that is the very commonly used the drug, gooseberry. Which the powder of amalaki, take 2 to 3 grams every day, can drastically respond with this problem. Or combine, you add with the turmeric powder, pure turmeric powder. Take 2 to 3 grams of turmeric powder, mix with honey, take 2 or 3 times a day, will be very effective. It is a very home remedy, anybody can practice, which is very effective in response to the upper respiratory tract infections. But make sure that your bridge is correct, there is no hypertrophy, there is no expansion of this area of the turbinates. If that is frequently coming, then consult an ENT doctor and see whether there is any problem. There are in Ayurvedic way, we consult an Ayurvedic ENT specialist and see the tract is, patency of the tract is correct. If the patency is still repeatedly coming, Ayurveda has advanced therapeutical measures like nasyam. there is a special method. We take a special type of oil, put it in the nose, inhale very deeply, and keeping the tract, the immunity of the tract is better, and cleaning this. And sometime this problem of upper respiratory may extend from nasal area to the oropharyngeal area, or the backside of the nose also may go to the throat area. Then we may need more advanced treatment. If it is related with the throat, we can use simple thing like a glass of water with a little salt water. Salt water gargling is very efficient. If it is severely burning sensation is there, we can use ghee, warm ghee, 1 or 2 teaspoon of ghee can be made gargling, can result in. But if the problem is repeatedly coming, definitely we have to evaluate the pathology behind it, and then we have to change the lifestyle of the person. Very oftenly this person, these type of things may be related with their immune system. So if we have to check it whether the immune system is very competent. If the immune system is fine, it is good. Otherwise we have to give some immune boosters of medicines like in Ayurveda, like Chayanaprasham, Kushmanda Rasayanam. There are many nice Ayurvedic formulations that can also effectively work on the upper respiratory tract infections.